I want to talk to you today about something small and easy to overlook that you might notice on a shopping list, a birthday card, or a signature, and that can occasionally be a meaningful clue worth understanding. A change in your handwriting, your writing becoming smaller, more cramped, shakier, or harder to read than it used to be. Perhaps your signature has changed, your letters have shrunk and crowded together, your hand seems less steady on the page, or writing has simply become more effortful and you're writing messier. And most people just put this down to getting older, stiffer hands, or not writing much anymore. But here's why I want to talk about it. While a change in handwriting often has an ordinary, harmless explanation, certain specific changes in handwriting can occasionally be an early clue to particular conditions worth recognizing and understanding. Which changes mean what can help you know when it's nothing and when it's worth mentioning to a doctor. So, today I want to explain what affects handwriting, the common harmless reasons it changes with age, the specific changes that can be meaningful clues, particularly the distinctive small, cramped handwriting that can be an early sign of Parkinson's, and the shakiness that points to tremor, and when a change in handwriting is worth checking. And I'll keep this calm and balanced, because most handwriting changes are ordinary, but a couple of specific patterns are worth recognizing. Let me start with what handwriting depends on, because understanding it shows why various things can change it. Handwriting is a remarkably complex skill, requiring fine, coordinated control of the small muscles of your hand and fingers, good control from your brain and nervous system, steadiness, the ability to see what you're doing, and healthy joints and hands. So, handwriting can be affected by anything that affects these. The fine motor control and coordination from your brain and nerves, the steadiness of your hand, the strength and dexterity of your hand muscles, the condition of your finger joints, and your vision. Because handwriting draws on so many of these, a change in it can reflect changes in any of them, which is why handwriting can be a sensitive, if non-specific indicator, picking up changes in fine motor control, steadiness, the joints, or vision. And this is also why most handwriting changes are ordinary, reflecting the common age-related changes in the hands, joints, and vision, while a few specific patterns reflect particular neurological conditions. Understanding that handwriting depends on fine motor control, steadiness, hand strength, and dexterity. The joints and vision points to both the common, harmless reasons it changes and the specific, meaningful ones. Let me give you the common, harmless reasons handwriting changes with age, because these account for most changes, and I want to reassure you first. Several ordinary things change handwriting as we age. The hands and finger joints can become stiff, achy, or affected by the arthritis I've discussed, making writing harder, less precise, and more effortful. So, arthritis is a very common reason handwriting becomes messier or more labored. General age-related changes in fine motor control and dexterity can make writing a bit less neat and steady. Reduced hand strength from the muscle changes I've discussed can affect writing. Vision changes, the haziness, blurriness, or reduced sharpness I've discussed make it harder to see and control your writing, so poor vision genuinely affects handwriting. And simply, many people write far less than they used to, by hand, in this age of typing and phones, so the skill gets less practice and can become less neat, which is completely benign. So most handwriting changes with age, becoming messier, less steady, more effortful, are due to ordinary things: arthritis and stiff joints, general changes in fine motor control, reduced hand strength, vision changes, and simply writing less. These are harmless, common explanations, and the great majority of handwriting changes are of this ordinary kind, not a sign of anything worrying. So, please don't assume a change in your handwriting means something serious. Far more often, it's one of these everyday reasons. Now, let me come to the specific handwriting changes that can be meaningful clues, because this is the part worth understanding while keeping it balanced. There are a couple of particular patterns of handwriting change that can occasionally be early clues to specific conditions. The most notable is a distinctive change where the handwriting becomes small and cramped, with the letters shrinking, sometimes getting progressively smaller across a line or a page, and the writing becoming tight and crowded, which has a particular name, micrographia, meaning small writing. This specific change, handwriting becoming abnormally small and cramped, can be an early sign of Parkinson's disease, because Parkinson's affects movement in ways that can shrink and cramp the writing, and it's sometimes one of the early signs, appearing along with the other features of Parkinson's I've discussed, like slowness of movement, stiffness, a rest tremor, reduced facial expression, and changes in walking. So, handwriting that has become distinctly small and cramped, especially shrinking across the page, particularly if accompanied by those other features, is the specific pattern worth recognizing and mentioning to a doctor because it can be an early clue to Parkinson's, which, importantly, is treatable in ways that help. The second pattern is shaky, tremulous handwriting, where the writing looks shaky or wobbly, which points to a tremor. And as I've discussed, the most common cause is the benign essential tremor, an action tremor that affects activities like writing, while Parkinson's tremor, being a rest tremor, tends to affect writing differently. So, shaky handwriting points to tremor, most often the benign essential tremor. So, the specific meaningful patterns are small, cramped handwriting, which can be an early clue to Parkinson's, and shaky handwriting, which points to tremor. Let me be careful and balanced about this, because I don't want everyone whose writing has changed to worry. Most handwriting changes, as I stressed, are ordinary, from arthritis, general age-related changes, reduced strength, vision, or writing less, and are not signs of anything worrying. The specific patterns worth recognizing are the distinctly small, cramped handwriting that can be an early clue to Parkinson's, especially with the other Parkinson's features, and shaky handwriting that points to tremor. So, a change in handwriting on its own, especially the ordinary, messier, or more labored kind, usually means nothing worrying. What makes a handwriting change worth mentioning to a doctor is if it's the specific small, cramped, shrinking pattern, particularly if accompanied by other symptoms like slowness, stiffness, tremor, or changes in walking or facial expression, or if it's part of a broader picture of changes you've noticed. And even then, recognizing the pattern is a prompt to get checked, not a diagnosis, since handwriting changes are non-specific and only a doctor can assess what's going on. So, the balanced message is, most handwriting changes are ordinary and harmless, but the specific small, cramped, shrinking pattern, especially with other symptoms, is worth mentioning to a doctor, as is shaky handwriting, if you want your tremor assessed. The point of knowing this is recognition and sensible follow-up, not worry about every change in your writing. Let me explain why it's worth recognizing these specific clues, because of what early recognition allows, particularly for Parkinson's. The reason the small, cramped handwriting clue matters is that Parkinson's disease, while not curable, is genuinely treatable in ways that can substantially help the symptoms and quality of life. And recognizing it, including from early clues like a handwriting change, allows it to be diagnosed and managed with treatment, support, and planning. So, recognizing that distinctive handwriting change as a possible early clue and getting it checked can lead to earlier diagnosis and the benefits that come with it, which is why it's worth being aware of, not to cause worry, but to prompt timely attention if the pattern, especially with other features, appears. Similarly, recognizing shaky handwriting as tremor, usually the benign essential tremor, allows reassurance and, if it's bothersome, treatment to help, as I've discussed. So, the value of understanding these handwriting clues is that they can prompt timely recognition and care of conditions that benefit from it, Parkinson's being diagnosable and treatable, and tremor being reassurable and treatable, while most handwriting changes simply reflect ordinary, harmless causes. That balance, recognizing the meaningful patterns while being reassured about the common ones, is exactly what I hope to give you. So, let me be clear about what to do because the path is sensible and balanced. For ordinary handwriting changes, messier, less steady, more labored writing, without the specific concerning pattern or other symptoms, understand that these usually reflect harmless causes like arthritis, general age-related changes, reduced strength, vision, or writing less, and address what you can. Manage hand arthritis and keep your hands mobile and strong, as I've discussed. Ensure your vision and glasses are good, and use writing aids like easy grip pens if that helps. See your doctor, and mention your handwriting change, if it's the specific small, cramped, shrinking pattern, especially if accompanied by other symptoms like slowness of movement, stiffness, tremor, reduced facial expression, a softer voice, or changes in walking, because that combination is worth checking for Parkinson's, which is treatable in ways that help. See your doctor if your handwriting is shaky and you'd like your tremor assessed, as I've discussed, or if a tremor is bothering you. And see your doctor if your handwriting change is part of a broader picture of neurological or other changes, or if you're concerned. The doctor can assess your handwriting in the context of your overall examination. Look for the features of Parkinson's or other conditions, assess any tremor, and guide you. So, address ordinary handwriting changes with hand, vision, and aid measures, and see your doctor about the specific small, cramped pattern, especially with other symptoms. About shaky handwriting if you want your tremor assessed, or if you're concerned. The reassuring message is that most handwriting changes are ordinary, while the specific patterns, if recognized and checked, can lead to helpful diagnosis and treatment. Let me give you the practical things that help with handwriting, and the hands generally, because much overlaps with what I've discussed. Keep your hands mobile and strong with the gentle hand exercises and care I've discussed, which help with the arthritis and stiffness that affect writing. Manage hand arthritis with warmth, movement, joint protection, and the measures I've discussed. Use writing aids. Easy grip or wider pens, which are easier to hold and control for arthritic or weaker hands, and other adaptive aids can make writing more comfortable and legible. Ensure your vision and glasses are good, since seeing clearly helps your writing. Write in good light and a comfortable position. And if a condition like Parkinson's or significant tremor is affecting your writing, the treatments for those conditions and occupational therapy can help, including strategies and aids for writing, so a referral can be valuable. So, hand exercises and arthritis care, easy grip pens and writing aids, good vision and lighting, and, if relevant, treatment of an underlying condition and occupational therapy all help with handwriting and hand comfort. So, even where handwriting has changed, much can be done to make writing easier and more legible, whatever the cause. Let me paint you a picture of how this can go, because it shows both the ordinary and the meaningful. Picture a woman in her 70s whose handwriting has become messier and more effortful, her hand less steady and precise on the page. In the common version, the cause is simply the arthritis in her finger joints and some reduced dexterity and vision, all ordinary, and she manages it with hand care, easy grip pens, and good glasses, and writes more comfortably, nothing worrying at all. That's the reassuring common case. Now, picture a different man in his 70s whose handwriting has become distinctly small and cramped, the letters shrinking and crowding, getting smaller across the page, and who, looking back, has also noticed some slowness, a slight tremor at rest, and a change in his walking. That specific small, cramped pattern with those other features is worth checking, so he, or a family member who notices, mentions it to his doctor, who recognizes the picture and evaluates him for Parkinson's, leading to a diagnosis and to treatment that helps his symptoms and quality of life. Treatment that benefits from being started in good time. The contrast is the lesson. Most handwriting changes, like the first woman's, are ordinary and harmless, while the specific small, cramped, shrinking pattern, especially with other features, like the second man's, is worth recognizing and checking because it can be an early clue to a treatable condition. Understanding the difference lets you be reassured about the ordinary and appropriately attentive to the meaningful. And let me speak directly to those of you caring for or close to an older person, because a handwriting change can occasionally be an early clue you're well placed to notice. You might see a loved one's handwriting change, becoming messier, shakier, or, notably, small and cramped on cards, lists, or signatures. You can help by understanding that most handwriting changes are ordinary, from arthritis, age-related changes, reduced strength, vision, or writing less, and are not worrying, while a couple of specific patterns are worth recognizing. Distinctly small, cramped, shrinking handwriting, micrographia, which can be an early clue to Parkinson's, especially with other features like slowness, stiffness, a rest tremor, reduced facial expression, or changes in walking and shaky handwriting, which points to tremor, usually the benign essential tremor. So if you notice the small, cramped pattern, especially alongside those other features, gently encourage a doctor's visit, since it can be an early clue to Parkinson's, which is treatable in ways that help, and recognizing it early is valuable. For ordinary handwriting changes, you can help with hand arthritis care, easy grip pens and writing aids, and good vision. And for shaky handwriting, encourage getting the tremor assessed if wanted, helping a loved one by recognizing the meaningful handwriting patterns, while being reassured about the ordinary ones, can prompt timely, helpful care for conditions like Parkinson's when the specific clue appears. Let me draw this all together. A change in your handwriting, becoming smaller, more cramped, shakier, or harder to read, can occasionally be a meaningful clue, because handwriting depends on fine motor control, steadiness, hand strength and dexterity, the joints, and vision, so a change can reflect any of these. Most handwriting changes are ordinary and harmless, from the arthritis and stiff joints I've discussed. General age-related changes in dexterity, reduced hand strength, vision changes, and simply writing less. But a couple of specific patterns are worth recognizing. Distinctly small, cramped handwriting that shrinks across the page, micrographia, which can be an early clue to Parkinson's disease, especially when accompanied by other features like slowness, stiffness, a rest tremor, reduced facial expression or changes in walking, and shaky handwriting, which points to tremor, most often the benign essential tremor. So, most handwriting changes mean nothing worrying, but the specific small, cramped pattern, especially with other symptoms, is worth mentioning to a doctor, as is shaky handwriting if you want your tremor assessed, because recognizing these can lead to helpful diagnosis and treatment. Parkinson's being treatable in ways that help and tremor being reassurable and treatable. Meanwhile, address ordinary handwriting changes with hand and arthritis care, easy grip pens and writing aids, and good vision. So here's what I'll leave you with. First, understand that a change in your handwriting can occasionally be a meaningful clue, because writing depends on fine motor control, steadiness, hand strength, the joints, and vision, but that most handwriting changes are ordinary and harmless, from arthritis, age-related changes, reduced strength, vision, or simply writing less. Second, recognize the specific patterns worth attention. Distinctly small, cramped handwriting that shrinks across the page. Micrographia, which can be an early clue to Parkinson's, especially with other features like slowness of movement, stiffness, a rest tremor, reduced facial expression, a softer voice, or changes in walking, and shaky handwriting, which points to tremor, usually the benign essential tremor. Third, see your doctor, and mention your handwriting if it's the small, cramped, shrinking pattern, especially with those other symptoms, because it can be an early clue to Parkinson's, which is treatable in ways that genuinely help, and recognizing it early is valuable. And if your handwriting is shaky and you'd like your tremor assessed. Fourth, for ordinary handwriting changes, address what you can. Manage hand arthritis and keep your hands mobile and strong. Use easy grip pens and writing aids. Ensure good vision and glasses, and write in good light. And fifth, hold the balance. Most handwriting changes are ordinary and reassuring, while the specific patterns, recognized and checked, can prompt helpful care. So the point is recognition and sensible follow-up, not worry about every change. A change in your handwriting is usually nothing worrying, but a couple of specific patterns are worth recognizing as possible early clues. So, understanding the difference lets you be reassured about the ordinary and appropriately attentive to the meaningful. So, take care of yourself, care for your hands and vision, and mention the specific small, cramped pattern, especially with other symptoms, to your doctor. And because interpreting a handwriting change and diagnosing any underlying condition require a doctor's assessment, please treat the specific concerning patterns, especially with other symptoms, as your reason to see your own physician who can assess and help rather than as a substitute for that care. And this discussion is for understanding, not a diagnosis of your own situation.